Hello and welcome to your daily dose of complete health with your local chiropractor, Dr. Patrick Hogg. Please like and subscribe for more videos.
Good morning, this is your daily dose of complete health with your local chiropractor, Patrick Hogg. And I got the joys of getting to go see my family yesterday, which is a massively rare occurrence. My dad lives in Shropshire, my sister lives in Worthing, my brothers and sisters live in Bournemouth. I have got a brother in Eastbourne, but the point is that life gets very, very busy and it can sometimes become really difficult to actually make and create time for people so you can actually get out and spend just some quality time with your family. And I may not be the only one, but I'm sure I know a lot of people that are very family orientated and they do this on a more regular basis than we do, but it can be months before I get to go and see my family between times of seeing them. But it's really interesting that when you look at the physiology and neurology that occurs during social interaction and what starts to happen to people's health as a result of regular social interaction, it is insane what kinds of results it can have on people's health. There's a really interesting study that was done that shows the risk of coronary heart disease is taken down by 2.5 times in people over the age of 60 if they've got a social support circle as opposed to if they don't. So e.g., if you are an elderly person and you're in the hospital and you've just had a heart attack and you haven't got anyone visiting you, you are 2.5 times more likely to have a negative outcome in that situation than someone who has got someone that's coming to visit them on a regular basis. Which is insane. But also, social interaction is shown to reduce anxiety, it's shown to improve our empathy, reduce our risks of stuff like depression, it makes us more confident, outgoing, and just generally makes us feel much better about ourselves. And when you look at those kinds of changes in our physiological state, in our moods, and what that starts to have an impact on stuff like our heart, our lungs, our liver, our stress hormones, what it starts to do is it creates the brain into a shift of safety as opposed to threat. And when we're in those shifts of feeling safe or feeling loved or being around people that actually care about us, what it starts to do is change the way our brain reacts with our body. And when our brain reacts with our body in a different way, it brings us from that state of stress into no stress. This is when our body actually starts to learn to calm down, rest, recover, digest, and heal. And this is one of the thoughts behind why not being in the stressful environments or being around people that care for us can have a positive impact, not only on our mood, but our actual physical health as well. And this is why those people in that study 2.5 times less likely to have a heart attack or heart disease as a result of having a social circle, because their brain and their body can come into that state of rest and recovery so they can actually do what they were designed to do, which is heal and recover and get over the issues that were at hand. So, like I say, keep yourself social, but do it in a healthy and active way. What kinds of things can we do that are potentially social and active? Go out for a meal with someone, but don't necessarily have to choose an unhealthy meal. You can go out for a drink with someone, but it doesn't necessarily have to be alcohol. It could just be a cup of coffee or tea. Go and do a sports activity, paddle boarding, rock climbing, whatever it is, but surround yourself with people. Surround yourself with a support circle that can actually make a difference, and surround yourself with a support circle that actually wants to support your health goals as well. Take care for now. Patrick from Complete Health. We'll speak to you soon.